All right. Hello, everyone. Thanks for joining this information call on a Monday after March break for many people. I'm Zaina Kayat. I'm the Chief Program Officer at AMS Healthcare. I've been in the role since October, and part of that is overseeing this program in addition to others. So I'm just going to set us up and explain a bit of what AMS is and a little bit more about what, this program we're trying to do with it to help you think about. First of all, congratulations on making it to this round. We had a lot of applicants this year, so we really want to help you put a good proposal together for the full application. So I'll do a bit of a setup and explainer of what AMS is and a little bit on this program. Maybe I'll stop to see if there's any questions, big picture. I've got Vanessa on. She's one of our current fellows that just went through this process, I guess, a year ago-ish. And so she'll just give some of her perspectives on going from letter of intent to full application and any other things. And then I'll hand it over to John and Andrea from the Ontario Sports Support Unit, which is who we partner with to adjudicate your applications. And we keep it very arm's length. We give our criteria, but they do a great job of kind of working through all of your applications with an independent expert committee. All right, that's the plan. If you've got burning questions or urgent, either come off mute or put it in the chat. And between Vanessa and John and Andrea, if I'm not seeing it, of course, please let me know. And we are recording this, so you can go back to it at another time if you missed something. We're recording, John?
Yes, we are.
Okay. So I'll just explain AMS. I mean, the original acronym, kind of like, I don't know, my students never know what IBM is. I'm like, they used to make machines, this company called IBM. They're now like a software and consulting firm. So, so Associated Medical Services, I believe, is the acronym, but we just go by AMS as we've pivoted quite a bit, the mission over 85 years. So you might recall when Medicare formed 40 years ago, there were a lot of private insurance schemes across the country, very local. We were one of them, AMS, I think owned by a bunch of physicians and insurance for diagnostic labs. And then the law was, well, now that we have Medicare paid for by taxes, these insurance schemes have to take their endowment of their pool of money that you would have paid premiums into. They can't kind of give those back because they're very old. So a bunch of little foundations are across the country, and we're one of them. And the mission of the has evolved. And in the last while, we've been focusing on really, I would say, unlocking imagination and investing in people that we think are going to think a little bit orthogonally to bring very new ideas to advance healthcare in areas where we have a lot of need. And our kind of common thread is this word compassion and kind of responsible care. And what's the responsibility of the humans involved in delivering care in all these new ways? In the last few years, that mission has focused more at this intersect of emerging technology, leadership, and advancing kind of scholarly knowledge. But the lens has always been compassion. And then there's a whole other arm of AMS that focuses on the history of healthcare. And we fund scholarly research and practitioners because actually to understand the future, it's really important to understand the history so that the two work well. So it's just a little bit of the DNA. But compassion is kind of the common thread that I think distinguishes this work from other fellowships in leadership or in technology. There's a book, that was written about it that is a bit of the Bible. But the basic idea is, as all this AI is coming that you're all looking to validate or test or roll out to hopefully make care better for certain people, how do you do it in a way that extends compassion instead of interferes with it? How do you do it in a way that enhances compassion instead of, makes it worse? How do you roll out these new technologies to amplify compassion instead of erode it? And there are so many ways where you can erode compassion as we're bringing in things that have a lot of human-like nature of AI. So it's becoming like really, really important to bring this top and front and center in the design of these tools. So that's a bit of the thesis. The whole platform of AMS does a lot of things. We invest with our money, so we're self-funded, which means every year we invest our nest egg in the stock markets. It makes some profits, hopefully, and we use that to put in what I call risk capital into big important areas of our health system that are hard to fund through other sources. And these fellowships is one of the, you can see a list of 4 or 5 things we use our capital to invest in. But more and more, we don't do that in a vacuum. We're not a granting agency. We also convene, which means we pick big thorny issues in the AI and health space, and we're trying to move the dial on them, either through educating, through inspiring, but maybe actual policy innovation. So we might incubate new initiatives off our convening, but that's often all that work is informed by our fellows like Vanessa. It's the work they're doing at the coalface of care, and they're backing into the same problems over and over again. And then we're like, okay, we're going to convene and try to move the kind of system. And then when we do all that, we learn a lot, we know a lot, and we meet a lot of people. So we also have an intention around influencing, shaping the policy discourse, shaping the mindset, shifting orthodoxy. So all sorts of channels of speaking and podcasts and Substacks, and we host events, and we're on social media, and I write a weekly AI and health newsletter that goes out to about 300 people. So that's the big picture. We're going to hone in on the fellowships. So our 2 flagship programs of AMS is, again, the history of healthcare, very long-standing. We fund chairs, grants. You can see all the activity across invest, convene, and influence. But really the majority is in this kind of compassion and AI. And I'd say the fellows is our crown jewel of all of our programming, but we do have 5 different programs that we invest in. We have a big conference in April on AI and healthcare. We've got other programs with senior fellows, and then quite a bit of being in the market influencing. So I'll just kind of finish and hand it to you, Vanessa, just to say what we're looking for now. You've all met the bar of the minimum we're looking for, to invest in the next leaders of developing AI. So there's kind of 3 lenses to what the program is. The fellowship is for sure leadership development. So, what is the leadership journey? What's your philosophy? Where can we help bolster your leadership trajectory? We do that through actual training. So you're in residence in October in Toronto, you're back again in April. But in between, we do these monthly optional 90-minute webinars that kind of do kind of hands-on training for an area you think you want to develop. For example, in November, we did a 90-minute on how do you move a policy through government. If your AI research is going to lead to some policy innovation, how do you do that if you're just a clinician or an academic? And Vanessa could probably speak to this, we also fund for you 10 one-hour private leadership coaching sessions. Very valuable. Of course, you're going to do your project. So, scholarship, being on the cutting edge of methods, tools on AI. So from that, we connect you to others that are going to help you go further, faster, better. We help troubleshoot our fellows because we kind of have a network. We help connect peer to peer to troubleshoot. We're starting those actually this month. We might see opportunities for you in the marketplace and say, why don't you go speak at that conference? So-and-so is looking for a panelist. British Medical Journal is doing a call. Will you write an article? Because when we know what you're working on, we can help connect you to those opportunities. And then at the end of the project, just to be clear, there's a requirement that you do a report both on the content, but financial report of how you spent the money, and then a narrative of your thing that could be kind of consumable for anybody that we post on our website. And then finally, a big part of being in a cohort is you're in the cohort of your current fellows, 10 or 12. So there's that community, but there's also all the cohorts before. It's one big community. We have 110 that we funded across all of our fellowships. So we try to get you to kind of mingle at our events, on our WhatsApp community, in our weekly newsletter, and then we're now starting these monthly small groups of fellows. So anyway, that's kind of the big program. Any burning questions on what is AMS and what have you gotten yourself into? me just check the chat. Are we good? Okay, if anything comes up, keep going. But maybe Vanessa, I thought you were a good example of someone who's been through the journey that I thought people might want to hear from.
Thanks, Anna. Yeah, I'm delighted to be here. Hi, everybody. Hope you're having a good Monday afternoon. I am going to chat with you a bit about why I applied, what my project is, and how I went from the letter of intent to the proposal stage, and some tips I found helpful in terms of succeeding and carving out your proposal. Hopefully this is helpful, and I'm open for any questions along the way. So I observed an organization through AMS that really cultivated thought leadership and really challenging orthodoxies. I am a really curious person. I love learning. I love growth. I love creativity. So I'm not big on social media, but I started to get into it because when I started to see AMS and what they were doing, I started following them over the past couple of years, and I thought, I really want to get to know these people. And so they action their words, and they really push boundaries well beyond status quo, and I love that. We have to be in this space right now, and sort of leapfrogging ahead. I found myself in a community of people that are innovative and thoughtful and very very active in terms of their thought, and it's a wonderful group to have collaborated with so far the past year and into the future. So I really also admire and value the different perspectives that AMS hones and that they look for within terms of history and operations and research. That was really important to me in terms of looking at how they are viewing compassion and AI through these different channels. And it's really intentional, deeply intentional, their work. So I am a nurse practitioner and I work in refugee health. And part of my proposal is really part of my DNA. So I think that is really a big step of success towards why I achieved the fellowship. My project is looking at implementing a virtual reality simulation to enhance team-based care in primary care settings. And that's following a newcomer patient through a system of care that is not very well connected. And so I'm trying to allow others who are not in the same place and in the same time to see themselves as a part of a team across health and social care settings. So I had this, this is part of my lived experience as a clinician, and really as some of the work I had done. I'd been participating and observing some virtual reality in the past. And my sister-in-law brought an Oculus to Christmas a couple of years ago. So I put it on. And I'd never done this before. And she said, no, I have it hooked up to Google Earth, so you can go somewhere. And I went back to the house I grew up in, which I hadn't been for 20 years. And I was nervous and afraid, but using this tool, it really allowed me to understand how this is a wonderful way to explore something in an experiential way that can feel nervous, but also safe at the same time. So I thought, I'm onto something here. I think we can do something with this, that it can allow people to recognize potentially a walk in the shoes of others. So this is my project that I pitched, that I'm currently working on. And how I did this was, I thought, gosh, I love learning. I love curiosity. This is my work that I recognize we have to do better for the patients that we care for. How are we going to get there? But I thought, this VR idea kind of wacky? And I pitched it to other people. So I gave myself a lot of time in advance, to pitch it, to talk to different people, talk to other AMS fellows who have also done VR simulation. They said, yeah, it's a great idea. This is who you can talk to. This is who you can, can allow you to build the tool that you're looking for. So I really had a chance to test the idea with others. Most importantly, I tested the idea with caregiver mentors. The two people that I'm working with who are my caregiver mentors, who I know from working in the field, and they were really they were into it. They thought, no, they recognized we had conversations and I talked to them about it, and they thought, indeed, that's also a really good idea. And I asked them, how do you see yourself in this? And then they told me how they could see themselves mentoring me in the process. So I had to give myself a lot of time to be able to do these and have these conversations with people. And I really think that recognizing you need often maybe more than one caregiver mentor, because depending on what you're developing and building, the more perspectives, the better, particularly if you're looking at something that is around diversity and expansion and scale. The letter of intent was really helpful in terms of looking at what the reviewers had said. I took those comments really seriously. In the letter, I highlighted them and I was really clear about how I was going to make sure to hone in on their suggestions, which was excellent and really helpful in terms of the proposal, which the first page of the proposal, you have to recognize how you're addressing the reviewers' comments. When you are requesting for letters of support, really from your mentors and your supervisor and those caregiver mentors, it really is a team that you have to recognize. It's a team project, and how are each person in terms of your team going to be able to contribute and support you in this process, and recognizing their own skills and their own experience in the contributions as well. I did lots of iterations of the proposal with my supervisor, which was wonderful to have the help of that. I found the word count hard, so I was able to go over and over and over again, trying to really make sure that the methods in particular were as concise as possible. And I think, again, to go back to the mentors, I think it's really important with every single mentor you have to be really intentional in terms of how their expertise and subject matter expertise will really guide you and support you in the process. So I think you want to really think about triangulating all these areas and bringing them together. So we can think about compassion, and often when we're creating topics and subject matter, it's clear to us how compassion is there, but you have to be very, very, very clear about what compassion is defined as in your project and how it is woven into your project, and what you've seen in terms of what is compassion to you, and how it will be transferred in terms of your project, as well as the idea of innovation. So where you are headed, what is the need out there, and also around your skill set. So what are you bringing? What are others bringing to this project? So I think throughout the whole proposal, you really want to make sure that you're bringing in compassion, innovation, the skill set of yourself and others, and really the forward-facing need about what your project will contribute towards. I mentioned using the reviewer feedback, really that they give you excellent comments. So really honing in on that because that's what they want to see. Mine were particularly around the methods, for example. So I found those quite helpful. And we talked about compassion, but I think you don't just want to say the word compassion. You want to say what that is. What does that mean in the context of your project? And maybe there's a precursor to the compassion or something that follows the compassion, but you want to be really, really clear about what that is and how that's interwoven and how you expect to see compassion be delivered, and also the outcomes of compassion within your project. Multiple angles, for example. I found it helpful to match objectives and phases to the methods. So you don't have much space. So I think it's really helpful for me to think about phases of my project and how it's going to match to the objectives, and really make that clear for the reviewer in terms of when things were happening and how. And also I used a framework, a theoretical framework, to help guide my process. Really important too to think about the opportunities beyond your project. If you do not have the chance to fulfill all the different phases you're looking for, to be really clear about feasibility around your project, but also what is opportunities beyond that, and potentially you could do another phase beyond what you've proposed. And acknowledging the limitations of your work, and as well as regarding your budget. And then the KT plan, again, you don't have much space, but really to be very concise and clear about working with for myself, it was working with my caregiver mentors and creating a toolkit, and to be able to look at publication within that. And so beyond KT, in terms of the impact you want to talk about, is really about opportunities to continue the process of engaging really beyond the different phases of your project. And really opportunities, beyond publication, about how this is going to really allow you to engage in a space that is really needed for the wider healthcare system, but also around your own interests and why it's so important to you. Hopefully that's helpful. What I learned in the process, so I guess maybe what set mine apart, like I really believed in what I was saying. Like I really, really believed in my topic. I really believed in the objectives I had outlined for my proposal. And I really believed and I witnessed why compassion is needed in this space and why we have to really take a leg up and leverage what we're doing. What I learned in the process is give yourself time. I think you have a lot of time to do a lot of iterations around your proposal, and also the time to engage with your caregiver mentors and your mentors as well to make sure that you're all on the same page around how they can support you and how looking at how that all ties together. I learned to go for it. You have great ideas, go for it, put it out there. And again, you have a team of people that you're working with to actually help guide you in some of this. I think there's a wonderful opportunity here to engage with other AMS fellows. And so if you have opportunities to connect with them around ideas of your project, I think it's really helpful as well to consider about what's on the website and who's done similar work to yourself, and looking at some of theirs as well. Hopefully that's helpful. I would say that it's probably one of the areas that I'm most proud of within my own work over the past 5 years is engaging this fellowship. And as I said, I really found people that I'm delighted to know and to talk to. And I'm really happy with the project, and I still feel really excited when I talk about it. And I know that's a great sign.
Yeah, great. Thanks, Vanessa, for sharing that. Any questions for me or Vanessa before we hand it over to John and the team to just talk about the process from here? Geneviève?
Hi, Vanessa. Thank you very much. I apologize. I have missed a couple of minutes, so maybe you have mentioned something that I have missed. But like regarding the level of details we have to provide, in the methods section. So it is a very good tip to match like the different phases with the objectives. But I found very difficult to let's say provide some details, like just enough, not too much, because I mean we have very limited words to say everything we want to say. So do you have any tips, like for example the sample size and like the precision regarding the methods of each phases? So any recommendations?
Yeah, I use acronyms. I tried to shorten as much as I could. I did a lot of referencing as well. Yeah, I mean, I think it's not easy. I think that's probably one of the harder parts. But I think the opportunity to do multiple iterations and really think about how, if you can mention something in the previous, in a previous introduction, you can kind of try to tie back to it, and also recognize that it might be an opportunity. I mean, certainly there will be question marks and things, but again, the reviewers' comments, it might make sense to you, but I think the reviewers' comments will be really helpful in terms of what you need to expand on in those methods, because when you're creating a project, it all makes sense to you,
Yeah.
but there might be a gap there that is missing. So just be really clear about honing in on that and what's ambiguous or potentially.
To the extent you want to and you're okay with your IP being out in the world, use AI just to help you. It's very good at getting it down to your word count. My students do this all the time with their assignments in my master's programs. I think the other thing is I know Vanessa focused a lot on the project, but that's not the only thing, right? So it is the whole package. It's your leadership story and your trajectory. It's the cohort. So we're looking for diversity. So it's not, the individual merit was the first round. Now it's like, you know, what's the unique mix of geography, of type of person, type of institution, type of AI, type of patient population. Like Vanessa hit so many unique things, newcomers, really co-designing with your patient partner. That was very fresh, I'd say. Nurse practitioner. What are the universities you're attached to, Vanessa, from a research?
Oh, I'm at U of T.
Yeah. Was it just U of T? I thought you were also.
I'm at U of T. I'm also at Sinai Health. I'm at like two hospitals and U of T.
Okay. And yeah, so a bit of all those things. Yeah. Alexia, is your hand up?
Yeah, thank you. So one of my questions is around defining compassion. I know AMS has a very specific definition of compassion, and we as individual kind of researchers might also have a definition of compassion. And so how do we kind of balance that, align that, and then also make it relevant to the context of the work.
Yeah, we're not being militant about using our definition in our book, although it'd be a good idea to get the book. As long as it's kind of an evidence-based definition, I think there's 5 or 6 pretty good frameworks out there. We're happy to share them. And that it's just like, I think Vanessa's done a great job of showing how it really comes out for this type of a technology.
Perfect, thank you.
Yeah, and I think really honing in on terms of what you've seen and why you, as a leader, as a scholar, what you've witnessed and what you've seen in terms of your own view of compassion, and that goes back to what Zaina was talking about around the leadership summary that you're doing within the proposal, and that builds to it. Like it's a story that you're telling. It really builds to that compassionate story and that lens that you're sharing. And then you're really owning it, and it's your view of compassion and how then that then further weaves into your project and for the future.
And I'll just add, and I don't know, John, if you shared it, but we did do a webcast on compassion and AI for all of our fellows, and we opened it up to all the applicants, and that's recorded. I'll put it in the chat right now while John's talking, the recording of that and the slides. I'll give you all of it because that might be helpful. And the person who was my predecessor, who was our chief program officer, she's a co-author of our book. So she did that webcast. Yeah. Okay. Well, John, let's get into the nuts and bolts.
Okay, let me try and figure out how to do this. Oh yeah, there I am. Or not. And I'm just gonna see if I can share. I did do a couple of slides. So everyone can see my slides, hopefully. Just with respect to the details of the competition, those of you who are successful, I know that we've invited a number of people to this webinar, but specifically for those of you who have been invited to submit to the full application stage of this competition. The submission deadline is April the 16th, 5 p.m. Remember to send it to the OSSU email address, and we'd like you to structure your file appropriately and your file name appropriately. Everyone who applied to the LOI competition did very well in that, so I don't expect any issues around that area. For a complete application, remember that you need to have your complete signature page, full application written out, the budget table completed, your curricula vitae for the applicant, supervisors, and mentors, but not the patient caregiver mentor. All we need for them is the letter of support. Letters of support are also needed from your supervisor and your mentors. Finally, you will need another letter of support from your sponsoring institution. So make sure you get an update of that. The only thing that I'll add now is just a reminder of the different weightings for the categories in this stage of the application. Leadership goals and potential is weighted at 35% of the evaluation. How compassion has been incorporated into your proposal, how it's been explained lovely in a wonderful way, the way Vanessa has presented it. But really, one of the things the reviewers really look for is to see whether you have discussed compassion, defined compassion, and its relevance, but then never mention it again in the rest of the application. You really need to see this as a proposal with compassion integrated throughout the application. I say that was 15%. And then for the training environment and the mentors, the scoring is for it, that contributes 10% to your final score. And as Zaina was saying earlier, really the novelty, the innovativeness of this proposal, that has a heavy 40% weighting for your applications. So ensure that you structure your applications to meet these particular weightings so that you have the best chance of being successful. Zaina, I don't have too much more to say. I'll open up to any questions that people might have.
Maybe, John, can you just remind us what happens, what the timelines are? You had it up there, but
The submission deadline?
yeah, and then what happens? Then what happened?
Oh, I see.
People
Oh,
can plan their life a little bit.
well, really, so for applicants, the next deadline is sometime in June. And I think that's when AMS sends the notification to the successful and unsuccessful applicants.
Yeah.
So the submission deadline occurs, and then on the 16th of April, I believe we said, but then there's a review meeting that happens. Andrew and I scurry in the background to get all the reviews written up and everything. We submit it to AMS, it goes to the board, they take a look at it, and then they let you know. And it's sometime at the end of June that this will happen.
Yeah. And I think, John, you expressed for the that about a third of what are being invited to full application, if all apply, we can award this year.
That's
Um,
correct.
yeah, and the one big one which kind of happened last year is so that first residency we now know will be the Tuesday to Friday, maybe the Thursday after Thanksgiving. So I want to say like October 12th to 14. You guys could look at the calendar, not the Monday. But that's when that's a mandatory in residency. I think we have that on the website, but we've had some people who already know they cannot come that week. So, you might not want to apply then because it is required.
I just want to highlight there's a question in the chat.
Oh, yeah.
You want to take a look. It's from Benita asking, would it be okay to update the mentor listed for this application? The mentor in the LOI stage will be retiring soon.
Yep, absolutely. And I think as Vanessa said, like it doesn't have to be just one. I liked your advice, Vanessa, of a few. So there's your mentor, which is your expertise mentor, and then your patient partner or caregiver mentors. So I love the team example. By the way, Vanessa, I'm going to steal that for future communication. Yep. I've put the link to the recording about compassion in the chat there too. I think another thing I'll just say, oh yeah, Jackie, hello.
Hey, Zaina. Thanks so much for putting this together. I just had a question that may have been answered with the last. So it's okay for the mentor. I'm considering expanding the team, so it's okay to add more caregiver patient mentors. And then the other question I had was more for sort of formatting logistics. It was a bit unclear to me how to embed references throughout the responses. Is there a particular approach that, not in terms of specific formatting approach, but we can just put them anywhere?
Yes. Yeah, the reviewers aren't picky as to where you put your references. They can be endnotes, and they don't count in your word count for the application.
Great.
Good question. Any other questions? I think Vanessa's example was one where we weren't fully like absolutely everything must be AI for last year because it was still very nascent in Canada and we weren't going to get the good applicant pool. So VR counted because it's very edgy, new technology, very different modality. And we did leave room for that this year, but I believe every one of you did do AI, which I think cleans it up a little bit more. I'll just say, um, we're on a mission at AMS to create the new leadership capacity for an AI-ready health system, patient capacity as well. We're piloting a patient fellowship program. I'll give you an example of some of the innovation we're doing. If you don't want to go to full application, but you're going to do work in AI and like please still be part of our ecosystem. I want to know what you're up to. John, as you know, for the folks who didn't make it to the next round, we're meeting them one-on-one. We want to know what they're trying to do and help them with their career because it could be that you get a grant or you apply later or you get involved in a different way in our whole platform. This is just one of them. I just wanted to give you that offering if you're not sure if you want to go to the full application. We still want to be part of your life if you will have us. Okay. Any other questions? Okay, well, thank you, Vanessa, for spending time with us. I know you have a lot going on, so really appreciate it.
It's a pleasure. Thank you.
And thanks everyone for getting on the call. Please reach out as you have been to Andrea and OSSU for questions. And if they're the kind that they can't answer, they'll always get them to me. So thanks, everyone. Good luck.
Zaina must have left. I guess that means we all should go.
Okay.
Vanessa, great job, by the way.
Thanks, Vanessa.
Thank you. It's a pleasure. Thank you so
Okay, you
much.
all take care.
Nice to see you.
Bye.
Bye.
Bye.